Understanding melanoma. Causes, detection, treatment, prevention. Melanoma, a type of skin cancer, has become a growing concern in the realm of public health due to its increasing incidence and potentially life-threatening nature. As the most dangerous form of skin cancer, melanoma originates in the pigment-producing cells called melanocytes, which are responsible for the production of melanin. This pigment imparts color to the skin, hair, and eyes. In this comprehensive article, we will delve into various aspects of melanoma, including its causes, detection methods, treatment options, and preventive measures. Causes and risk factors. Ultraviolet radiation and sun exposure. Excessive exposure to ultraviolet, UV radiation from the sun, is a primary risk factor for melanoma. The harmful effects of UV rays can damage the DNA in skin cells, leading to the development of cancerous cells. Prolonged sun exposure, especially during peak hours, increases the risk. Sunbathing, tanning beds, and activities in sunny climates without adequate protection contribute to the accumulation of UV damage. Genetic factors. Family history plays a crucial role in determining susceptibility to melanoma. Individuals with close relatives who have had melanoma are at a higher risk. Specific genetic mutations, such as mutations in the CDKN2A and CDK4 genes, are associated with an increased likelihood of developing melanoma. Skin characteristic. Fair skin, light-colored eyes, and blonde or red hair are common features associated with increased susceptibility to melanoma. People with these characteristics have less melanin, which provides less natural protection against UV radiation. Immunosuppression. Individuals with a weakened immune system, whether due to medical conditions, organ transplants, or certain medications, have an elevated risk of developing melanoma. Detection and diagnosis. ABCDE rule. Dermatologists often employ the ABCDE rule to guide the identification of potential melanoma signs. This mnemonic stands for asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, and evolution or changes over time. Regular self-examinations using the ABCDE rule can aid in the early detection of suspicious moles or skin lesions. Skin biopsy. A biopsy remains the gold standard for diagnosing melanoma. In this procedure, a small sample of the suspicious skin tissue is removed and examined under a microscope to determine whether cancer cells are present. Treatment options. Surgery. Surgical removal is the primary treatment for early-stage melanoma. This involves excising the tumor along with a margin of normal surrounding tissue to ensure complete removal. In cases where melanoma has spread to nearby lymph nodes, surgical removal of affected nodes may be necessary. Immunotherapy. Immunotherapy has emerged as a promising treatment for melanoma. This approach harnesses the body's immune system to recognize and destroy cancer cells. Checkpoint inhibitors, such as pembrolizumab and nivolumab, are examples of immunotherapeutic drugs that have shown efficacy in treating advanced melanoma. Targeted therapy. Targeted therapy involves using drugs that specifically target the genetic mutations associated with melanoma. BRAF inhibitors, such as vemurafenib and dabrafenib, are examples of drugs designed to block specific mutated proteins in melanoma cells. Chemotherapy. While not as common as in other types of cancer, chemotherapy may be used in advanced melanoma cases where the cancer has spread to distant organs. Chemotherapy involves the use of drugs to kill or inhibit the growth of rapidly dividing cancer cells. Preventive measures. Sun protection. sun protection remains the cornerstone of melanoma prevention. This includes wearing protective clothing, such as wide-brimmed hats and long-sleeve shirts, and using sunscreen with a high sun protection factor (SPF). Sunscreen should be applied generously and reapplied at regular intervals, especially after swimming or sweating. Regular skin checks. Regular self-examinations of the skin are crucial. For early melanoma detection, individuals should be aware of any changes in the size, shape, color, or texture of moles or skin lesions. Professional skin checks by dermatologists are recommended, particularly for those with a family history of melanoma or other risk factors. Avoiding tanning beds. Tanning beds emit harmful UV radiation, contributing to an increased risk of melanoma. Avoiding tanning beds and seeking alternative methods to achieve a tan, such as sunless tanning products, can reduce this risk. Educational initiatives. Public health campaigns play a pivotal role in raising awareness about melanoma and promoting preventive measures. These initiatives aim to educate the public about the dangers of excessive sun exposure, the importance of early detection, and the significance of regular skin screenings. Prognosis and outlook. Early detection and treatment. The prognosis for melanoma significantly improves. With early detection and prompt treatment, when diagnosed at an early stage, melanoma is often curable with surgical intervention. Regular skin checks and awareness of potential risk factors contribute to early detection. Advanced cases. If melanoma progresses to an advanced stage and spreads to distant organs, the prognosis becomes more challenging. Advanced melanoma may require a combination of surgical intervention, immunotherapy, targeted therapy, and chemotherapy. Conclusion. Melanoma, a formidable adversary in the realm of cancer, demands our attention and proactive efforts towards prevention and early detection. Understanding the risk factors, embracing sun-safe behaviors, and adopting regular skin examinations are vital steps in reducing the incidence and impact of melanoma. Advances in treatment options, including surgery, immunotherapy, targeted therapy, and chemotherapy, offer hope for those diagnosed with this formidable disease. By combining individual awareness with public health initiatives, we can strive to mitigate the risks associated with melanoma and work towards a future where this potentially deadly form of skin cancer becomes a preventable and manageable condition.